For caregivers, it can be hard to know how to help. What's the most meaningful support they can provide around nutrition?
I think every patient needs a good support structure around them. And it's very hard for caregivers because it's a very stressful time. It's hard to see how a family member or a friend um, experience the challenges that they have to live with through treatment. And I think any good support starts with good communication and to try and um, communicate effectively what you as a patient need. And I also encourage patients usually to communicate with a family member how they can be helpful. Um, Tell people what foods sound good to eat, what foods look good to eat. Explain to patients what you experience, or the supportive care, the caregivers, what you experience during eating, and then explain to them how they can be supportive. Um, I think it's also important to have patience with the patient um, because their day is different from day to day. The only consistency of cancer treatment is inconsistency. We can't plan too far ahead. We have to kind of take it day by day because side effects from treatment compound and over time change, and we have to pivot from day to day, sometimes week to week, with what the patient is experiencing. I think from a caregiver perspective, to um, be there with emotional support, reassure your family member that things are okay, even though you're having a challenge now. Take the next few sips and then take a break. Um, Also, find activities away from eating because we focus so much on eating, but I think we also need time to step away from eating. Um, and have other healthy distractions. Maybe go for a short walk. Maybe build a puzzle. Maybe spend time outside in the garden. Find something pleasurable that is not always focused on eating and hydrating, um, just so that the patient also can feel I can focus on other things uh, different from eating. And I think it's also important for the family member or the caregiver to pay attention to changes in the patient's mood, how they feel, so that they can also communicate and advocate for their family member with the medical team. Because sometimes patients just don't feel well and they just don't want to necessarily communicate with us that something is not working. But if your care team, your medical care team, is not aware of any challenges that you have, there's no way that we can assist you in addressing the challenge at the time.